Thank you for joining Cancer Support Community Atlanta for the Tell Me More series. This program focuses on treatment options for multiple myeloma and is facilitated by Dr. Bambrah with Suburban Hematology Oncology Associates. For information on other installments, please visit Cancer Support Community Atlanta's website at cscatlanta.org.
My name is Ramandeep Bambrah. I'm a hematologist oncologist at Suburban Hematology Oncology Associates in our Lawrenceville office. I'm going to be talking to you today about what happens after you've been diagnosed with multiple myeloma. Multiple myeloma is a varying disease. It can stay stable for many months. Some people need treatment right away. There's different risk categories, and if your physician feels like you are higher risk, you may end up starting treatment sooner. If you have symptoms of active multiple myeloma, you will definitely be advised to start treatment right away. So today I'll be covering some common treatment names, common side effects, and then managing those side effects. There are a multitude of regimens. I'm going to cover two of the most common ones we use up front when you're treating first line. There are multiple medications that are utilized for later lines or if you have a different medical problem, but these are the most common ones that I'll be going over today. So in a general overview, these are the drugs that are used to treat multiple myeloma. You'll be using an immunomodulatory drug, corticosteroid, a proteasome inhibitor, and immunotherapy. This decision is also based on your medical problems, your lab results, and a decision with you and your provider. Overall, the one that has been around for many decades is what we call RVD for short, which includes Revlimid, which is a pill that you would take by mouth, Velcade, which is a shot given in the belly by the nurses, and dexamethasone, which is a steroid pill that you would take by mouth at home. Overall schedule can be also varying and dependent on your medical comorbidities, your lab results, but overall the Revlimid can be taken 2 weeks on with a week off. Velcade can be given 2 times a week, and then the steroid is weekly. Potential side effects of this regimen basically include having bone marrow effects, which is the whole goal of myeloma treatment. So you can see your blood count start to change with low white blood cells, low platelets. You can get anemia. Sometimes you need transfusions. You are at a higher risk of infection. There can be allergic reactions to medications. Blood clots can occur, swelling, even rash. Then some non-specific symptoms that can occur with the GI tract include nausea and constipation and abdominal pain. Fatigue is definitely part of the regimens. Sometimes it can be pretty severe, and then you can talk to your physician about ways to manage it. You can also see paresthesias, which means numbness or tingling, headache, and then very rarely you can get herpes zoster reactivation with Velcade, and we'll touch on that in a little bit. The other regimen that is now very widely used is adding immunotherapy to the RVD. This is with daratumumab or Darzalex. This is a shot now. They also have an IV version, but in our offices, we are using the injection. It makes the treatment time much shorter. This is also a varied schedule. We start off weekly. You will keep the same medication with the Revlimid daily. Velcade will be once or twice a week, and then your steroid is weekly. Overall, the side effects are similar. The adding immunotherapy does have a unique change that can happen with your blood. We do recommend getting type and screen before you start Darzalex because it does make it look abnormal. You can get low blood counts, an allergic reaction, and we do give pre-medications, including Benadryl, in the infusion room. Some patients may need what we call bone support if the multiple myeloma has affected your bones. This usually is a monthly support medication, either intravenously or injection. The overall class is what we call osteoclast inhibitors. They basically suppress this activity and stop the bones from deteriorating. Overall, this translates into less pain, less bone lesions, and eventually less incidence of fractures. After treatment, you may be offered maintenance therapy. Also, this is very dependent on your clinical course, your labs, and up to you with your provider. Overall, it's given to keep the myeloma suppressed after initial therapy. The choice of agent varies based on various things. And most often after first-line therapy or stem cell transplant, we are using Velcade injection or Revlimid pill. This is intended to continue over long term, and we continue to explore various combinations. So managing adverse events. When you're on steroids, we do recommend taking it with food and the daily acid blocker to help protect your stomach lining. Also recommended aspirin or a stronger blood thinner, depending on your clinical status, to decrease the chances of blood clots that may happen with Revlimid. We also provide antiviral to prevent herpes zoster or shingles activation while on Velcade, and often we provide a antibacterial and antibiotic to prevent infections. So you may see different things. Everyone is different. Everyone has different side effects. Some may get minimal, some may get many, and most of our patients fall in between somewhere. Nausea and vomiting, we recommend medications to take to ease the nausea and vomiting. We say you may need to change how you are eating. Typically, eating smaller meals more frequently will help you. If you're experiencing diarrhea, we do recommend that you stay as hydrated as possible and take anti-diarrhea medications and try to eat a low-fiber diet. If you start experiencing constipation, we recommend that you take stool softener. Sometimes you may need laxatives, drink more fluids, and then eat high-fiber foods and try to stay as active as you can. Some patients may experience peripheral neuropathy or numbness, tingling in the hands and feet. There may be different medications to treat nerve pain. You can discuss this with your physician. It's basically physical therapy can also help. Being active can help to stimulate the nerves in your hands, feet, arms, and legs. We recommend wearing comfortable shoes and keeping your hands and feet warm. Other things that we see with treatment, which is expected, is going to be bone marrow suppression. When you become anemic, you may feel more tired, and with severe anemia, you may start feeling short of breath with exertion or minimal exertion. Very rarely we can see kidney damage. Labs are watched frequently when you are in treatment, so this is not common, but we do recommend that you drink lots of water to keep the kidneys healthy. Other important things are to rest when you can, but try not to become too sedentary. Studies have shown that patients that are actually more active as much as they safely can do better when we start treatment. We recommend incorporating healthy whole foods as much as possible, and always talk to your provider about how you are feeling. That's what we're here for, to help you mitigate any symptoms as much as we can. Ask for help when needed, and utilize resources that are available to you. Each office has different resources, and they're here to help. Other ways of managing is also keeping a track of your side effects. It helps to know maybe what day of treatment it occurs, when does it get better. Again, eating well, relaxing, getting enough rest, while also still trying to be active is important. Be kind to yourself, and most of these side effects do go away after treatment ends. Thank you. To connect with free oncology support resources like support groups, please visit Cancer Support Community Atlanta. That is cscatlanta.org.
Thank you for joining Cancer Support Community Atlanta for this program. If you're interested in other live or recorded programs, please visit the online program tab of our website, cscatlanta.org, or follow us on Facebook. We'll be sharing additional information on upcoming programs.